Uh, Thank you very much indeed. Thank you. Can you all hear me? Right. I take it, yes, I trust you hear me. So many things are taken by trust. So thank you very much indeed. All protocols observed. And I'd like to welcome you all to this extremely important topic and discussion, examining the human cost of migration in Africa. I'm sure you have noticed how difficult it has been for us to adapt to this new normal. And we were time and again, of course, given orientations like the Kudo expert has been already giving to us. And migration involves like such things. They have to migrate from where they have been always comfortable, like pre-coronavirus time, we're so comfortable to welcome you very easily. But here, I can't say post, but during coronavirus time is almost always learning time. So in this learning time, we can also see when we are out of our comfort zone, how much we really feel, how what we face. This is just a list comparison to what's meant by migration, how migration definitely involves so many intricate cases, particularly the human cost aspect. And this human cost aspect must be situated in African context, either a source, a transition, or even destination, both ways. So we have very well-versed personalities who can share their excellent understanding and intellectual insight with us today. We have Joel Risk, Migration IDP Advisor, ICRC, Dr. Maharit Haddasa, part-time professor, School of Transnational Governance and Migration Policy Center, Robert Schuman Center for Advanced Studies, European University Institute, and Sabelo Mbokazi, Head of Division of Labor, Employment and Migration at African Union. So I will be with a privilege and of course honor being facilitating here. So I'd like to once again welcome you very warmly and thank you very much indeed for joining us. So I'm sure the first minutes would be still a time of testing and trying. So if you happen to practice or experience or undergo some glitch, that is normal part of what we are doing, that we're learning when we are joining online or webinar seminars. So I'm sure you will bear with me. So with that very quick remarks, I would just quickly say what IPSS is doing currently and at the same time why IPSS is very much interested in this extremely important and timely issue, examining the human cost of migration in Africa. IPSS basically was meant to be engaged in peace, conflict, security, development, and governance issues, both as academic department and, of course, also a policy actor. So with that huge objective in mind, it has peace education, peace research, policy dialogue, and community service agenda. So with this, we take as part of these four pillars at once. So we, as we said already, have distinguished speakers from here among us. So I'll call upon first, maybe for Mr. Bruce Mkaya Reina, Head of Delegation, ICRC Delegation to the African Union, to give us his opening speech. My brother and Excellency, time is yours.
Thank you so much, Jonas, for those introductory remarks, and I want also to thank all the participants who are joining us from all over the continent and also from outside the continent. It's really a privilege and it's a timely discussion that we are having. That is coming at a time when we are seeing increased migratory movement across the world, but also at the same time, as Dr. Johannes, you saying that is causing a lot of life is spreading. States are imposing very restrictive measures as well. At the same time, measures which obviously are meant to contain for public health
breaking. Can you, hello, Bruce? Hello? Hello?
Exacerbating the vulnerabilities of these populations. So evidently there is a disproportionate impact that a number of these measures that countries are imposing are having on migrants in terms of their health, access to to information. But also we have seen that a number of countries have imposed measures that have also frozen, if not delayed, the whole process of issuance of visas and all the administrative and legal protection measures that migrants ought to have. So while of course we recognize that during this pandemic that states may, for purposes of public health, impose some of these restrictive measures, but at the same time, I think it's important to ensure that there is a human rights-based approach to ensuring that that the migrants' rights and their well-being is taken care of. Above all, that they are able to access the basic needs. I must applaud the actions and the statements, and I'm glad that we have the head of migration unit at the African Union joining us here, Mr. Sabelo, to see the work that the African Union has been doing lately, and also the engagement of the African Union and African member states to look into the welfare and the issues surrounding African migrants, as we have seen lately in a number of countries, the appalling conditions and the challenges that they are having. So, of course, we have seen in the last 1 week that the AU has really remained quite seized of this matter. And I think it's important that we applaud those efforts to ensure that migrants are protected wherever they are. So the webinar really comes in at the right moment that we need to examine some of these practices that the countries are putting in place and share some of the challenges and come up with some of the solutions that are out there for purposes of ensuring that we provide assistance and protection to migrants. My really last message is that the primacy has to be for the respect of migrants' life and the fundamental rights and protection over the containment and border control measures that countries have. So it's really to put the primacy on the respect of the migrants' lives and their fundamental rights over and above the the administrative measures that countries may have. Even though, of course, we are living at a time when it's important to ensure public health measures. So I wouldn't want to get into some of the issues that our distinguished panelists will be getting into. But I really wanted to take this opportunity as well, Dr. Yones, to say thank you for also finding time to moderate this session, but also to acknowledge the emerging collaboration and partnership that the ICHC and the IPSS are forging on some of these policy dialogue issues. I thank you all and look forward to very fruitful deliberations. Thank you.
Thank you very much indeed, Mr. Bruce Mkaya Arena. That is absolutely fantastic. It really sets the scene very neatly so that our distinguished speakers...
Joel, the floor is yours now.
Dr. Yones,
yes,
the floor is
Joel,
back to you.
Yes?
I know.
Yes,
Joel.
Yes, Joel is now taking up. Right.
Thank you, Dr. Yones. Thank you, Bruce, as well. If you'd allow me, I would actually keep my video off for the presentation because I'm experiencing some challenges with the connection. So I'll keep the video off and I'll put the presentation on.
Great.
Just to confirm that you can see the presentation.
Indeed, yes, we can see.
All right. Okay, thank you. So thank you, everyone, and thank you for giving me the opportunity to present the ICRC perspective on the humanitarian situation of migrants in Africa today. I'll be starting with a small note on how the ICRC defines and how the Red Cross and Red Crescent movement defines a migrant and who we see as a migrant, recognizing that there is no universal definition to who a migrant is under international law. And I'll speak a little bit briefly on the ICRC approach on migration. Then we'll discuss with you the humanitarian situation of migrants, specifically focused on the protection concerns that we observe in connection to migration along migratory routes in Africa. A small note on how that has been impacted by the pandemic, by the COVID-19 pandemic. And then I'll very briefly highlight a few major points of ICRC response on migration in Africa. So, as just said, there is no universal definition under international law to who a migrant is, and the definition often changes from organizations and states and contexts. However, for the Red Crescent and Red Cross movement, we define migrants as persons who are outside their country of origin or their habitual residence. So this definition is very broad, as you can see. Meaning migrants can be workers, they can be students or irregular or foreigners with an irregular status vis-a-vis the state or the country where they are working. But more importantly, it also includes refugees. The definition of migrants includes refugees, asylum seekers, or stateless persons, or other people who may be in need of special protection under international law. And the reason why this definition for the movement, definition of migrant for the movement is broad, it's actually deliberate. And some of the reasons why is to include all people who are fleeing or leaving their homes, whether they are seeking safety or whether they are seeking better prospects. So regardless of the motivation to leave, that they may still be included in that definition. And in a way that it recognizes that many migrants actually become vulnerable along the way, and they may, along the migratory journey, have become in need of special assistance or protection. For the ICRC, our migration approach is primarily a movement effort. It's done in coordination and in partnership and complementarity with other movement components, notably national societies, so Red Cross or Red Crescent societies in every specific country, and as well as the International Federation of the Red Cross and Red Crescent societies. So we work together or in partnership, sometimes in complementarity, each in their own area of expertise. The approach is strictly humanitarian in the sense that it does not take sides, knowing that migration often becomes a political, is very highly politicized subject. The ICRC does not take sides in political controversies and always puts vulnerabilities of migrants at the center of its approach, and does not make it subject to political arguments over, for example, what a legal status is. And primarily, as a movement, and especially the ICRC being a neutral organization, we do not encourage migration nor discourage migration. And the focus is always on helping the most vulnerable, regardless of their legal status, recognizing that these vulnerabilities are very different from one stage of the migratory journey to another. During transit or destination, or during one place or a country or another, these vulnerabilities will be different. And obviously the focus also for the ICRC in our own areas of expertise, and I'll elaborate a little bit more on that later, I would especially highlight the work on separated, missing and dead migrants, the work done on diversion from detention of migrants and the promotion of alternatives to detention instead of immigration detention, and the bilateral and confidential protection-based dialogue with authorities. Moving forward to discuss the humanitarian situation of migrants along migratory routes in Africa, I would just make a small note that we recognize that the majority, maybe some figures speak of 80% of migratory movements within of African migration are actually internal to Africa, whether within African regions, or between or inter-regional within Africa, for example, from Eastern Africa to Southern Africa. However, we also recognize that some of African migration is trans-regional, meaning beyond Africa, for example, to Europe or to the Middle East, which would also mean that for protection dialogue, that the protection dialogue on migration for Africa is not always and only African centered, but it may also include actors beyond Africa. And obviously, the policies then of actors outside the African continent or African countries then may also impact migration within Africa. Migrants often transit through areas of armed when they are on their migratory journey. They often transit through areas of armed conflict and situations of violence, or other situations where they may become trapped in life-threatening conditions, or conditions that may increase their vulnerabilities. All along their routes, they may become easy targets for abuse and exploitation by different actors, including non-state actors. And some migrants lose contact with their families, they may become also missing. They may suffer accidents or serious illnesses, and may be unable to access medical care. So there's a lot of situations within which migrants go through along the migratory journey. But we will highlight some of the major humanitarian concerns that we have observed, specifically linked to safe access to services along the migratory route, that they may not always be available or accessible to migrants. It may not be, even if there are essential services available, they may not be safe for migrants to access them in fear of arrest or detention or deportation or other forms of fears that migrants may have, which, for example, may prevent them from getting essential life-saving service, or from maintaining contact with their family. Another concern that we would highlight is the access to safe and legal pathways, especially for people in need of international protection, or people with specific vulnerabilities, such as victims of trafficking, victims of abuse, such as migrants that have passed through areas of conflict and they may have developed specific protection concerns. So access to asylum, people with the special need of special protection under international law, such as refugees. So access to people in need of international protection, and their access to safe and legal pathways along the migratory journey is also an issue of concern. I'd also highlight family separation and migrants going missing, and here maybe say a few words on that. Migrants usually are unaware of the risk of separation when at the time of departure. They're not always aware of the risk that involves to lose contact with their family along the migratory journey through transit and destination countries. They lose their phones, they lose their numbers, they forget the numbers, they forget the country codes, they don't have connectivity, they're not in an area where they can actually establish contact. The reasons may be different. So in that sense, connectivity is very crucial for migrants to prevent them from being separated from their families. There's obviously a lot of reasons why migrants may be separated along the journey from their families, such as arrests or going in different convoys at different times, losing contact. That's why connectivity is very crucial along the journey. We'll talk a little bit more about that later, but I just wanted to make a note on this as well. Also, to clarify that migrants go missing for a variety of reasons. However, the likelihood of them going missing is increased when they are compelled to take dangerous routes, many of which are experiencing armed conflict or other situations of violence, or that they may be crossing through hostile environments such as the sea, the deserts, remote areas. So all of these conditions. Sorry, there's somebody speaking, I think. I'm not sure who it is. If you can kindly mute your microphone. Yeah, thank you. Migrants may also be crossing through hostile environments such as sea and deserts and remote areas where they become isolated from help and from services, and then they may be facing life-threatening conditions and situations along the journey, which will increase the likelihood of them going missing. And this likelihood of migrants going missing will also increase if they are compelled to hiding during transit or destination countries. And reasons why migrants would hide are, for example, fear of being arrested or being detained or deported. So all of these factors increase the likelihood of migrants going missing along the road. And just as a clarification, missing migrants do not necessarily mean that they are dead migrants. They might as well be alive, but just missing in terms of loss of contact with their family and not their families having no information on their whereabouts. Another concern in that sense is that migrants become increased, and it's related to this likelihood of migrants going missing as well, and the safety of access to services. And the other points that just mentioned is migrants becoming increasingly more invisible, and as the more that there are restrictions on movement, the more that there is policies that are focused on countering migration rather than on the humanitarian needs of migrants. Migrants have less trust in services, and they go in hiding. They become more invisible to humanitarian actors, and they also become more and more reliant on irregular services such as smuggling, and potentially fall into trafficking, and they become invisible that when they also use more remote and less accessible routes to migrate. And that is a concern, not only because it increases the likelihood of going missing, but because it isolates them from life-saving services as well. Another concern that, and then I'll move to the next focus. Another concern is also the sustainability and the safety of returns. We know that a lot of migrants are part of voluntary or so-called voluntary return programs. They also choose to return home. Sometimes they are compelled to return to their homes or unable to return to their homes. So the sustainability and the safety of the returns of migrants is also a concern, because we observe that often migrants, after their return, either they don't have access to services that they may need, such as mental health support, or that they may end up again trying to migrate because of different factors that they may experience back home. And here I'll highlight the impact of migration policies without specification, but more broadly, we observe that often with migration policies that are not focused on the protection needs and the vulnerabilities of migrants, there's often an impact on the freedom of movement, including within countries that have freedom of movement, that usually have a freedom of movement of persons, like such as the ECOWAS countries. And also it impacts more traditional movements that are like the transhumance, the movement, the pastoral movements that are very common in many regions in such as the Sahel, for example. There's seasonal migration and circular migration that is very traditional and essential to the economic development of many populations. That this then broader migration policies may also affect these more traditional movements and have obviously economic consequences as well. We also observe that it's increasing the vulnerability of migrants by further limiting their visibility, as we just discussed, and their safe access to services, which then in turn, it increases their proximity to irregular actors such as smugglers and traffickers, which on its own then exposes them to a whole different array of exploitation and risks. We also are concerned specifically with instrumentalization and the politicization of aid in the world of in the file of migration, particularly as migration becomes the topic becomes politicized, and sometimes funding available for humanitarian actors may not be connected only to humanitarian needs, but rather to policy implementation tools. I will focus a bit also on the impact of COVID-19 and how the pandemic has further affected the humanitarian concerns linked to migration, specifically in terms of delays in humanitarian evacuations due to also flights and closure of airspaces and borders. Also, resettlement procedures have been delayed. Return programs have been also delayed. So this has created more situations where migrants are in specific situations for longer time, where they are stranded, possibly also for longer movement restrictions, as we just discussed. Also, migrants stranded in border areas. So these are all the impacts of the measures that were taken to control the spread of the virus. Deportations and increase in forced returns. With here we highlight concerns linked to the respect of the principle of non-refoulement and the due process for the protection of migrants in need of international protection, which may not have been fully or always taken into consideration or applied during deportations or returns. But more importantly, here we also highlight the perception of migrants and the trust of migrants in essential services and service providers that has been affected due to different dynamics that may be linked to stigmatization of migrants. Also, then migrants feel that they have less trust, or they perceive that services may not be as safe for them anymore, and then their access to essential services would be impacted. As for the ICRC, I will highlight here two aspects of our response. This presentation will allow me to go a lot in the details, but I will mention some of the highlights in our areas of expertise. Primarily, we focus a lot on bilateral dialogue, which is a confidential dialogue with state authorities or other authorities on the respect of the principle of non-refoulement and maintaining avenues for asylum. This was also specifically important during the COVID-19 pandemic to highlight this aspect of the dialogue, or to stress on this aspect of the dialogue, particularly as much of the COVID response is centered on border management, closure of borders, and restriction of movements, and this made the principle of the respect to the principle of non-refoulement and maintaining avenues for asylum ever more important. We also, an important part of our dialogue is on prioritizing saving lives, and on such as, for example, in search and rescue operations in the Mediterranean Sea, among others, to increase legal and safe pathways for migration. Also, to ensure that humanitarian funding for migration is available in a way to preserve the humanitarian space and address migrants' needs rather than containment objectives or migration policies. And that protection of migrants is at the center of migration policies. These are some of the components of the dialogue that the ICRC engages in at bilateral level, but also in other aspects such as humanitarian diplomacy efforts as well. Another aspect is the work done on prevention of family separation and disappearances or migrants going missing. And here there's dialogue with states on adoption of policies that contribute to this prevention of family separation and migrants going missing. There's also a lot of work done around more humanitarian diplomacy efforts and policy dialogue, such as recommendations for policymakers that are prepared by the ICRC on prevention of migrants going missing, the discussions, also the inclusion of objective number 8 on saving lives and working on missing migrants, which was integrated in the Global Compact on migration. So these are just to name a few.
Joel, may I ask with love and respect, may I ask you to just summarize in 3 to 5 minutes so that we can have more time for discussions and engagement. So far, it's excellent. Thank you so much indeed. 3 to 5 minutes to summarize. Thank you.
Thank you. It's only one more point that I'm making, and then we can, excuse me. Yes. So also within the work that is done by the ICRC on the prevention of disappearance and separation along migratory roads is the activities that are done to reestablish contact with families, or to maintain, not to lose in the first place, contact with families, such as awareness raising on the risk of separation. As I said earlier, migrants often are not aware of the risks. Preventive messaging along migration routes, not only in countries of departure. Preventive messaging on the risk of separation. Also the assistance in actual reunification of families whenever possible. Establishment of antennas along migratory roads, together with the national societies as well, to maintain connectivity and to maintain contact so that migrants, as they move, they are able to connect with their families. There's also other tools such as the Family Link Networks, which is a network of national societies across the world working on maintaining family maintaining contact with family, or tracing. There's also a Trace the Face, which is a tool, also online tool for families to look for their, to search for their loved ones. And in some cases also we do needs assessments of the needs of the families of missing migrants, and then provide assistance to that end, such as in Senegal. And in many contexts, we also support first responders and forensic authorities for the proper management of the dead, and they support also in the adaptation of the legal framework and the concept in the frame of management of the dead as well. That's a whole range of work that I won't be able to go into details on that now. Finally, I just want to also highlight, for some reason you cannot see it. Yes. Just to highlight a bit, Trace the Face. Here we have where migrants from where families from more than 48 African countries are actually looking for their loved ones through this tool. I'll also, just for reference, mention a few documents that may be useful, specifically the note on the protection of migrants in the face of COVID-19, which was dispatched to many countries and authorities across the world, actually, and a document on recommendations for camp inclusive response related to COVID-19 pandemic, the recommendations for policymakers on missing migrants and their families, and the second ICRC comment on the Global Compact for safe, orderly, and regular migration, with a focus on immigration detention. I'd invite you also to consult these documents. And thank you. I'll be happy to take questions, I guess, later on after the other speakers.
Thank you so very much indeed. Thank you. That's extremely comprehensive, very much informative, starting from what is meant by migration, the very word, the semantics, and then the theoretical foundations and the dynamisms. So I think these really give us a secure background for us to delve confidently into our discussions and deliberations, as we, of course, hear two distinguished minds who are now already ready. So I'll first call upon Dr. Mahari himself, who complained not hearing. Now I'm sure he acknowledged that he can hear us clear and loud. So Dr. Mahari, time is now yours. Dr. Mahari, can you hear us? Hello? Hello, Dr. Mahari? Hello? Then I'll move until Dr. Mahari comes in. It's not uncommon in webinar discussions and presentations. So I'll move on to Mr. Sabelo Umbokazi, Head of Division of Labor, Employment and Migration of the African Union. Your Excellency, are you there? Hello? Dr. Mahari is back. Great.
Dr. Mahari is here.
Now,
yes, good morning or good day to all of you. Thank you so much, Jonas, for IPSS and ICRC for having me. And I would like also to thank the previous speakers for so Sabelo would have covered. And I'm very happy in that regard that some of the issues that we have been talking about for a long time has been brought forward. I just wanted to focus on a few points only, and so that the discussion could lead to more focus on the human cost of migration. So the first one I want to discuss is the human cost of migration. What do we mean by that? And how does it manifest itself in our continent, and when migrants from our continent live beyond the region or the continent? And the second is I will also try to talk about why is the human cost of migration very high as we speak? Why is it high? What are the causes for its gravity and magnitude in terms of the cost on migrants? And the third one, I would like to go back also to the what can be done in this regard. What should be the focus from the African Union, regional economic communities, member states, the international community, and different actors like ICRC, and even IPSS itself as a think tank, as educational and training center in bringing the discourse to the right track. So the first one is the human cost of migration. I think generally speaking, when we talk about human cost of migration, usually it refers to the death or missing migrants, dead or missing migrants, usually, even if the cost is beyond that. But the term of human cost qualified by human is referring to the dead or the missing migrants. And let me start with numbers first. Some of the estimates, especially from IOM, usually, shows that the conservative estimate I'm talking shows that there are about 35 days per week, very conservative, 35 days per week of migrants since 2014 up to now, and more than 3,500 days per year, most often en route and on transit, but some also on destination after arrival. Countries could include Saudi Arabia, Yemen, for example, or European countries like Italy, which had highest days in border areas. And it could include drowning, starvation, dehydration, exposure to weather conditions, vehicle accidents, shooting in border areas, and so on and so on. So there are many reasons or causes of the days, but you have huge number of days, 35 days per week. And it's not only on transit, on harsh condition and so on, but even in countries that are developed in border areas, days happens. Most often, there are also some countries who are origin of migrants, whose citizens most also are exposed to die. Guinea, for example, is one of the countries where its citizens and migrants die in large number for various reasons, and perhaps because the involvement of smugglers and traffickers on the route. Now, also there are also several kinds of physical attacks. In addition to loss of lives, physical attacks, torture, rape, physical attacks by being eaten or attacked by wild animals, especially on the route to the southern route, South Africa and so on. By criminal elements, from organ harvesting that happen by traffickers and so on, to gangs who who impose financial penalties and financial extortions of different kind. And enforcement officials also involved in corruption. Of course, the impact of COVID also has been mentioned. It's an additional cause of loss of lives and at the same time physical, mental, and health issue. And many and tens of thousands are stranded migrants. We know, for example, the recent coverage that we have heard about Saudi and Yemen migrants from Horn of Africa, mostly from Ethiopia, who are in Yemen and in Yemen, especially border area between Yemen and Saudi Arabia, who are most often forced to pay 100 or around that amount per day for different kind of services to armed groups, those who are in control of as de facto authorities in border areas, and shooting at them, attacking them so that they can cross to Saudi Arabia forcefully. And Saudi Arabia banning their entry. At the same time, those who have entered, they are detained in a condition that are appalling and also very dangerous for their health, given the pandemic is mainly use human as a vector, and sanitation and other issues like space, ventilation and so on are very critical for its prevention. So we know all how COVID specifically attacks migrants, including forced migrants, but also those who are in situation of detention and so on. And migration in general and displacement as a pre-existing exacerbating condition for COVID propagation of the virus, coronavirus. Mental health, of course, there are many issues, development of complex mental health problems related to it, and the social and economic cost of migration in general has significantly increased, especially when we talk from humanitarian, from forced migration, and from displacement, but also in the case of pandemics or in situation of pandemic, how it affects. Given also we know migration is not about negative, there are many positive aspects of migration, which I think is not the main topic of this discussion, but migration has been a force also for growth, development, innovation, and economic renewal and rehabilitation in many countries, including in Africa and so on. But since we are talking about human cost of migration, I'm going to focus on the costs that are related to loss of life, physical attacks, mental health issues, and so on. But I think many of the situation has been presented by a colleague from ICRC. All of them has alluded to this point in a very good way. I want to appreciate that. But I want to focus, why is the human cost of migration very high? And the first one, and I think this was clearly alluded to in the opening remark, and strict migration containment strategies that are imposed earlier, but since 2015 especially, but earlier within Africa, for example, from South Africa, a bit earlier since 2006, 2007, containment of migration through criminalization of mobility, closing borders, stricter policies on borders, and so on, has increased the cost of life, cost of migration, the human cost of migration. Criminal networks that are interested mainly on profiting from migrants and migration at any cost have also increased significantly from this. So criminal, highly sophisticated networks that have tentacles from local to regional level has also increased the cost of migration in general. Restrictive access policy to asylum which was introduced by many countries in Europe, but also in Africa, some countries in Africa, is a challenge also. It has increased the human cost, because by increasing restriction to access asylum, especially those who are forced to flee and they don't have any other choice, then they don't have those kind of luxury to choose which route, which destination, which transit, and so on and so on. And as a result, they have to take those kind of risky, dangerous, fatal routes of migration. And this is on top of the border, restrictive border control that were imposed. In some countries, the welfare policy of once they arrive, also the welfare policy could also contribute to human cost. If it is not a good welfare policy, generous one, people can die, migrants have died. There are several research that show welfare policy can contribute to the deaths of migrants once they arrive, especially children, young children, young girls, and so on. They may die out of various reasons, but the policy protection of migrants is not sufficient enough to protect them from death. In some cases, network for migrants, especially family and kin community support from migrants, reduces the human cost in many ways. Deaths have reduced where migrants use existing network of their kin community, family members, and so on, and it allows them to mitigate some of the risks that they face on the routes, and it helps them to take those journeys. Now, if we talk about this in general, and also if we look at some of the implications of this, then you will see that we need to focus on state responsibility. The primacy, which was mentioned earlier also, the primacy of state responsibility for migrants. Migrants are human beings, and human rights are for human beings, bare minimum basics. And the state where migrants are responsible for them. And the responsibility is a minimum one. They can go beyond that, but at least the protection of human rights, basic human rights, is a must. So states have, and we have to squarely put that the primary responsibility to protect migrants lies on states. That includes their, if they wish, the right to return, free movement, the right to return to their countries of origin. And so the states of country of origin have responsibility, first, to provide decent livelihood and protection for their citizens, so that they are not forced to migrate out of their will. What we want to encourage is mobility where it is voluntary and legal. Voluntary, that the person who is moving is not forced out of his will or her will, and at the same time that such kind of mobility happens within the legal parameters of the country of origin, country of destination, and country of transit. At the same time, we want to address, not only promote mobility, we want to address irregular migration, trafficking, smuggling, forced migration in general, displacement, if you wish. Be it IDPs, internal displacement, or external displacement, which is refugees. That has to be addressed, it has to be minimized. And that responsibility is on the state, countries of origin mainly, but also countries of transit and countries of destination. And various laws have provided guidelines and binding claimable rights for some segments of migrants. For refugees, we have clear laws. For IDPs in African continent, we have clear Kampala Convention and internationally also the guiding principles. And beyond that, we have also for basic human rights for all human beings, which includes migrants. Countries of transit also have duties that it emanates from this primary responsibility of state, and they have to provide protection, human treatment of migrants. And countries of destination, of course, they have to respect the minimum human rights for migrants that are critical. Now, for values and points to critical one has been, there were a deliberate de-emphasizing of some values and concepts in the past few years, if you wish a decade or so, that we need to address. The first one is we need to bring human rights at the center of migration discourse, migration policies, migration actions. Human rights has been abandoned deliberately from the migration discourse. And it's incumbent on think tanks like IPSS and institutions of human rights protection in general and protection in general like ICRC and institutions of governance, regional and continental governance like African Union, to emphasize, to call upon the international community and other actors to bring back human rights where it belongs. At the center of migration crisis is the issue of human rights crisis. Human rights are being denied to migrants because they are migrants. But human rights were for human rights. And that is very important. We need to bring human rights at the center as anchor of the discourse, policies, and actions. The second one is the focus on non-Mediterranean routes is important. Most deaths, most physical harm, most economic and other kind of social and other costs are happening on non-Mediterranean routes. The Gulf countries, the Middle Eastern routes, Yemen and so on, is by large the largest number of people. Deportations of hundreds of thousands, migration per year of hundreds of thousands through Yemen. And then the appalling situation within which migrants are managed and treated in the Middle Eastern countries. This is undermined, de-emphasized because not enough media, not enough energy and time and resource has been allocated to these issues by countries of destination, which they don't want. And countries of origin, because they differentiate their response based on regime type. They know the Middle Eastern countries, most of them, which are undemocratic, human rights standards are not really maintained, let alone for migrants, for their own citizens. So they allow the violations to continue. We have seen it, deportations from Saudi Arabia and Qatar and UAE, the situation that they are treated. So we have to bring the non-Mediterranean routes, Southern African route, which many are also dying and in containers, suffocated. And the news doesn't cover it because it is not what I call the rich or more to-do migration route like the Mediterranean route. If you see the cost to Middle East, it is affordable route. If you see the southern one, it's a medium route, medium cost route. The Mediterranean is the highest compared to the others. And because the European Union has brought a lot of resource, migration diplomacy, financial diplomacy, and media narratives, and so on, that it has dominated as if it is the biggest one. It is not. So it's incumbent on all of us to bring the attention and focus on non-Mediterranean routes. The root cause approach has been also abandoned, and deliberately so. The root cause approach was something that the AU and member states of the AU has been bringing since 2005 in the African migration policies of different kinds. Why is the root cause important? Why is development important? We know, and researches, recent ones and previous ones, show that indeed the poorest doesn't move the farthest. It is those who have some income that move. But at the same time, at certain cap and with some point of indifference point, as economists call it, there are caps where if there was some decent livelihood, many potential migrants wouldn't move to dangerous routes. We can talk about one point in this regard, and that is the gap between the living standard the African youth demands, aspires, the living standard that they aspire one for the youth, and the living standard that is in reality actual on the ground are too big. And there is a need to narrow that down. The more we narrow that, the less there will be forced migration, smuggling and trafficking. There will be more mobility, which is important and which we need as Pan-African integrative opportunity of free movement of people. So the root cause approach has to be brought back again. The African Union has to insist, REX has to insist on bringing development with migration as important instrument. The last 2 points I want to raise is the issue of accountability. We need to hold our countries, our governments on migration issues. They have skipped the accountability on this regard. Migrants have been considered as a cost in general, even by countries of origin. And it's in rare cases where there is a terrorist attack on migrants or there is deportation of large number that it comes to the prominence. Otherwise, it doesn't even feature in the top 10 national policies of many of the countries of origin. The big number, like Ethiopia, for example. Where is migration in terms of priority in that country? And Nigeria, and Guinea, and so on. They don't really, politically, there is big lack of accountability in this regard. The issue of accountability of countries of origin, African countries, the issue of accountability of transit countries, the issue of accountability for the deaths of many at border areas in Europe and elsewhere, including South Africa, the way they are treated in South Africa, we have to hold them accountable. That is important work to be done. And the issue of responsibility sharing, especially on refugees. Until now, Africa has failed to quantify the amount, the cost that it paid to host millions of refugees. Refugees are not hosted in national systems on behalf of the national government or the population of a country like Uganda or Ethiopia, which hosts more than 1 million. They are hosting refugees on behalf of the international community. And for that reason, the burden has, or the responsibility, whichever you prefer, responsibility or burden has to be shared. And to share that, we have to quantify how much is the cost for the country, the host countries, in terms of land, environment, social, and other economic costs that they are paying to host refugees. And the last one I want to bring is in relation to accountability and in relation of focus of our discourse, policies, and actions. We need increasingly not only accountability, but the preventive aspect of the bad mobility. The bad mobility, bad migration, like trafficking, smuggling, and displacement, internal or external, we have to bring more accountability. It's only when rights are claimed by citizens that accountability can come out. So it cannot be differentiated from the regime type we had, whether they are democratically accountable, constitutionally accountable, and so on. And at the same time, we have to promote the good mobility, which is legal, fulfilling the requirements of countries of origin, destination, and transit, and also at the same time voluntary, that it's not forced and people are not forced to move to other places, but for greener pasture, for progress, for economy, tourism, education, health, and other kind of things. Let me stop here, and there will be one point that later on, if time permits, I will bring it. Thank you, Jonas.
Thank you so very much indeed. Thank you. It's really mathematically used time. Thank you. Very appropriate and to the point. Those three pillars have really helped us to follow you very clearly, both scholarly as well as, of course, someone with hands-on data and experience in research. Dr. Mahari, I can't thank you enough. When we come back for more engagement and deliberations, we'll see the best yet to come. Now, let me go back to my brother Sabelo. I can see him. Yes, Your Excellency. Can you hear us? Dr. Sabelo Mbakazi? Yes, I can see. Right, now the time is yours. Sure.
Thank you, sir. Thank you very much, Dr. Jonas and Mr. Bruce, who gave us the opening remarks. And the colleagues who are part of this meeting, which is focusing on examining the human cost of migration policies in Africa. Distinguished colleagues, ladies and gentlemen, as the African Union Commission, we are pleased and it is our privilege that we are able to also contribute to this discussion. But I want to thank the colleagues who have come before me, who have really laid the foundation. The first speaker, Joel and Dr. Mihari, who have really laid the foundation and provided the philosophy on migration and mobility and the frameworks, who have also provided a good overview on the discourse of migration and mobility discourse. So thank you very much, colleagues, because then you have done a very good job, such that I will be I'll be short in my interventions. Since you have provided a broad overview and the philosophy and situated us on the discourse of migration and mobility, and also what you have done very much eloquently is to raise the current issues, including the impact of COVID-19. But what Dr. Mehari has done also, which is great, is to define the human cost of migration. So I think what I will be doing now is just to say, what is it that as African Union, what is it that we are doing to be able to deal and to address all these challenges that you have eloquently pointed out right from the beginning. Chairperson and distinguished colleagues, I will only address myself to, let me say, 5 issues. 5 issues briefly. One, I will talk about migration governance. 2, I will talk about addressing irregular migration. 3, and then I will focus on migration data and research. And then 4, I will talk about international cooperation and interstate engagement or interstate mechanisms. And then lastly, I will talk about labor migration and the type of interventions that at AU we are focusing on. First of all, on migration governance, to be able to address all these challenges that colleagues you have raised, we have a policy that has been adopted by member states that is called Migration Policy Framework. And within this migration policy framework, then it provides us with a framework then that we use to be able to drive some of the policy propositions, some of the policy options for us to be able to support member states to respond to some of the pertinent issues that we have raised that have to do with even the root causes, the challenges that we have eloquently raised that are experienced by migrants at the country of transit, at the country of origin. First of all, here, what we have picked up is that the issue of migration and mobility is an emerging policy issue at the member states. So what we have discovered when we did some evaluation, we discovered that some of the member states do not even have focused policies. So what we are doing under the migration governance is to build the capacity of member states. How do we do that? We go into member states under what we call a technical facility. A technical facility, that's where we have some resources. GIZ is supporting us on this area, where we have some resources that we can then take and go to member states and assist them, for instance, to develop the national migration policy framework. And then we also provide support in terms of the migration institutional arrangements so that they then have the capacity to address the issues of migration. This is one of the interventions around migration governance. So we think migration governance is a very important issue at a member state, but also part of this is we develop the curriculum. We provide support on the development of training on migration governance, targeting the senior officials and also parliamentarians. This is what we do at a member state level. So ladies and gentlemen, Chairperson, I'm just providing highlights, but I also want now to move to my second point, which is addressing irregular migration. Of course, there are so many questions on this area. So many questions have been posed. What is African Union doing? What are you doing on challenges that are manifesting themselves? For instance, in Libya, in the Mediterranean area there, what is it that the AU is doing? Quite a lot. For instance, I will mention here the flagship initiative that is called Joint Task Force. It's called Joint Task Force on the Libyan Migration Situation. This task force, because in migration, what we have learned is that it cannot be a solitary, one-man show. You need partnerships. And therefore, AU and EU and United Nations partners, most particularly the IOM and also UNHCR, are part of this arrangement that is called a tripartite task force that is able then to move into, and all these partners are using their core competencies and their comparative advantages, so that when we move to Libya, they are able to provide a support to the stranded migrants that are in Libya. So that is one of the flagship, and also AU then provides its advantage also on political engagement, and so this is exactly what the AU is doing now to address the issues on stranded migrants in Libya. This is led at a very high level. It's led by the commissioner at AU, who was appointed by the chairperson of African Union Commission. So one of the key interventions there is to move the migrants and repatriate them to a safe place. Through this project, we have been able to establish, with the help of a member state, transit emergency mechanism in Rwanda. And there's another one also in Agadez, in Niger. So some of the migrants that are repatriated from Libya are then moved to these transit emergency centers, which has been graciously provided by Rwanda. Ladies and gentlemen, also under addressing irregular migration, we also have an initiative that we call Horn of Africa, AU Horn of Africa Initiative. Here it is a state-driven initiative where we bring together most of the countries that are part of the Horn of Africa, and it is then the countries that are assisting us to be able to define the policies, but also to come up with interventions that are going to assist to combat particularly the human trafficking that has manifested itself in Horn of Africa countries, but also to strengthen this area of fighting human trafficking and combating human trafficking. The African Union Commission currently is developing TIP policy, the trafficking in person policy, which we hope it will be ready by the end of this year. But we are also developing a policy that is called smuggling of persons policy. So these two policies will be ready. So this is what we are doing also to contribute and to support member states, at least with policy options and policy and some policy propositions on how to deal with human trafficking, particularly under the banner of the AU Horn of Africa. Also, IOM is working with us here to support this initiative. I also, within this also a thematic area, we are working very hard on the area of RRR, which is the return, reintegration, and readmission. So we are working particularly with European Union to be able to engage the European member states on issues to do with return, so that, as it was mentioned before, there's an observance and adherence to human rights. Colleagues, ladies and gentlemen, let me now talk about what we are doing on the area of migration data research and research in the continent. You might have heard that the member states have approved for the development or the establishment of 3 centers, migration centers across the continent. So in Morocco, we are working at the moment for the operationalization of what is called migration observatory, which will focus on compilation and definition of statistics. Then that will be used to define and to improve policies in Africa. But in Khartoum as well, we will be having a migration center that will focus particularly on gathering intelligence and information around human trafficking. We are partnering here with the EU. We are also partnering with Interpol to be able to combat human trafficking and smuggling of persons, a phenomena that is on the rise. But then, ladies and gentlemen, I also wanted to highlight that on the area of international cooperation and interstate mechanism, we have a mechanism because migration requires dialogue and exchange of ideas and exchange of best practices. So we have what is called the PAFOM, Pan-African Forum for Migration. in Africa, where we bring in, which is also a member state driven, but it involves all the partners. It involves all the stakeholders that are working in the area of migration. It happens at the moment once a year. This Pan-African Forum for Migration, which is a dialogue platform, that is now at a continental level, but at a global level, we also work closely with EU, and we have what we term continent to continent a dialogue, what we call it MMD, that is Migration and Mobility Dialogue. It's a dialogue between for Africa and EU, where we talk about issues of labor migration, talk about issues of harmonization of policies, particularly on labor migration. So this is one of the key areas that we use to be able to engage other continents. So the last one, I said I will speak about labor migration. On labor migration also, you would have noticed that during the COVID-19, one of the areas that were impacted upon is the space on labor and employment. And so our AU and our department here, Department of Social Affairs, is also driving policies to be able to provide support to member states on issues to do with labor and employment. For instance, we provide capacity building for instance, labor inspectors at a national level, labor inspectors for the protection of labor and employment, and also to promote decent work, so that when people move to the workplace, we promoting the issues of international observance of international standards. But these are the standards that also we use to engage with other regions like the Gulf states, like the EU, for the protection of labor migrants. And so, ladies and gentlemen, I thought my parting shot would be the issue. My parting shot would be the issue of the labor migrants in Saudi Arabia. So, because we need to be practical. Yes, we have talked about policies. Maybe the question that arises, yes, Sabelo, you have talked about these policies, but are they helping us? You have talked about international cooperation. Is it helping all of us? Colleagues, ladies and gentlemen, the chairperson of the African Union issued a statement about the situation that we all maybe have seen in Saudi Arabia, when some of the labor migrants or labor workers or labor migrants were subjected and they were staying in places that were appalling. So when we issued this letter, or chairperson issued this letter, then we received a letter from a gentleman who is sitting there, he says he is a doctor from Nigeria. He's staying in Saudi Arabia, and then he wrote to the African Union. One of the things that he said, I am a doctor. I have seen and observed the Africans, especially women, in Saudi Arabia. The circumstances, I'm reading a letter that the gentleman issued after he saw the statement of the chairperson who he was condemning. He was also providing the position of Africa in terms of the labor migrants. He is saying that the circumstances of them, of women in Saudi Arabia, most are raped daily on daily basis by the father and sons and friends. A lot are unpaid even after concluding their contracts with in the homes there. I think they are working as domestic workers. Most get diseases and die in there, in the homes of the masters. Some of them cannot even access hospital and health facilities. And then he's writing recommendations. He said, we need to pass laws that will not allow female immigration. This is what he's saying to these member states. Pass legislation to favor women at home or at member state in order to discourage them to travel or to leave Africa to go and do these low jobs in these countries, because they are facing challenges in these countries. So I said, let me just read this letter. This letter is dated 13 September 2020. So it's recent. Chairperson, thank you very much for your time. And thank you, colleagues, for your attention.
Thank you very much indeed. What an emotional discourse to end the presentation with. Thank you so very much, my brother Sabelo, and that's fantastic, to be honest. It touches both intellect and emotion of humanity, and then how we can possibly engage. Earlier, as we already mentioned, Joel was talking about what's meant by migration, which sets a sort of ontological basis, and how can we deal with it? What are the way out, which is being dealt with, of course, by my brother and, of course, colleague Mahari. And finally, what are the practical aspects, institutional responses, and what should they be? That's been, of course, given to us by Sabelo yourself. That's been absolutely fantastic. And I was asked one question: what's being done by IPSS? I think this is a living memory. It's a living evidence for you to see that engaging with these migration issues, we have 3, 4, 5 projects. One is, of course, currently being done with DIE from Germany, and another one with EGAD, and of course with many others. We're also engaged in this extremely human, tragic aspect, and we're also trying to make how knowledge can be useful to transform such lives, because for us, making knowledge work for transformation of society is a primary goal. I'm absolutely delighted in all those 3 fine minds, and of course the keynote speaking at the same time earlier. So I should thank you so very much indeed. I will start with 2 questions forwarded to us, one from an institution called Baha'i International Community, and their question goes like this. I'm reading it. Investing on human development would have been better in many ways, so that people don't leave their country without choice. There is also the dilemma of investing prevention of disappearance and separation versus encouraging migration by making the route safe. Once people are migrating, the need for ICRC's service is unavoidable. How shall we, finally, focus on making countries safe for its citizens to live and enjoy their God-given human rights? This question comes from Baha'i International Community. And so may I just invite 3 of you to reflect on this, and then I'll move on to this next question, which was, of course, individually forwarded from Chalo Demisi. I'll just come back to that. First, who wants to go? Julie, yeah. Are you there?
Sure, I'll just make a point on the question of the preventive action for prevention of family separation and disappearances / migrants go missing along migration routes. And whether that what the person has called it as a dilemma versus making routes more safer.
Joel, you're breaking. Your voice needs sort of quality. Could you just do something for that?
Is that better now?
Excellent indeed.
Okay, so I'll answer to a portion of that question, just by making a note that when the action to increase the connectivity of migrants and giving them the chance to maintain contact with their family, and the preventive work that is done on the prevention of migrants, of disappearances and family separation, is actually after the fact. So it does not influence the decision to migrate. So this action, we don't engage with migrants on whether they want or decide to migrate or not. They decide that on their own. As I said, as ICRC, we don't encourage nor discourage migration. And the fact is, the reality is that even on routes that are inaccessible, that are remote, and that are isolated from services, migrants continue to go, regardless of how safe, and as we know, often it's very unsafe. And that is, again, why this kind of preventive action is very important, because, as we say, we always prioritize saving lives and the prevention of separation of families. So this action is very crucial, even more crucial in that aspect. And just as a side note on this, just for the information of the participants, that the preventive action and the preventive activities that the ICRC conducts along migration routes is always done in transparency with national authorities. So they are aware of the services being provided along migration routes as well. So I hope that answers the question or on the dilemma between providing services for preventing separation and whether or not these make routes safer and therefore encourage migration. So I hope that answers the dilemma.
Thank you so much indeed. It's just like Joel, the name itself. Thank you. Very well done, well addressed. And I'll come to Dr. Mahari, who has got two answers for this. The first one was he touched upon this back to basic root causes of migration, which of course he almost mentioned. Secondly, he also wanted to maybe make use of 1 more minute to finish his point. So he could be addressing the question itself and at the same time his additional points to make. I'll give him 1 or 2 extra minutes. Dr. Mahari, the time is yours. Dr. Mahari, are you there? Hello, Dr. Mahari? In the meantime, I'll then move to my brother.
Can you hear me?
Yes, we can.
Okay, well, I think our colleague from ICRC has addressed it very well. Probably I will only deal with the aspect of first, I think, again, for Africa, the basics is very important because it is our own problem in ways also as opportunity. For Africa, of course, we have discussed it in detail. The state responsibility has to be stated with clarity, with full clarity. And I think that's the reason why we are saying migration is a developmental issue. It's a political economy issue. It's a human rights issue. And it's even a Pan-African agenda in terms of integration. It's an integrative force if it's managed very well. Now, there are issues among ourselves in treating African migrants. In South Africa, we have seen it. In Libya, we are seeing it, even within the continent. We need to improve that significantly, and African countries, member states, should not simply sign into things or documents in Addis Ababa and then they forget it when they return to their capital. They have to implement it, and that is a work in progress. There is a need for more emphasis in that regard. Of course, there are also black holes in terms of international human rights and humanitarian law, where ICRC is trying to play a role, but it has to do even more in that regard, especially in pressurizing countries in Europe, for example, who are paying different de facto forces, including militias, to run detention centers. And legally, you cannot control these centers effectively. And it's very difficult to hold them accountable because they are not state actors, and there are no effective government that controls the territory, and you cannot bring them to account for these failures. And ICRC has a convening power, a mandate, and to influence many of the actors, and it has to play more role. But African Union, the same thing, on many fronts, which it is trying, but still it needs to work towards that, and we have missed a lot of opportunities. I give you two cases. The first one I have said, these detention centers, for example, being run in Northern Africa, where border agencies of Europe has moved to African territories, borders, border posts, airports, and so on and so on. Of course, collaboration has to be allowed. Still, we live in state sovereignty, era of state sovereignty, so they have a sovereign right to have a bilateral arrangement, but it should be done within the Pan-African spirit and context that the policies of other continents should not hamper the policies that are Pan-African in terms of free movement and less border, more integrative and people's border instead of colonial border that we have now. We want to undo that, so any partnership should be limited in that sense and spirit. The second aspect, which I think we need a lot of work that needs to address, is of course the issue of not only the internationalization of this aspect, but the localization. Ultimately, migration is a local decision. It's an individual decision. And that's the reason why colleague from ICRC was saying, even with the knowledge of the dangerous routes that migrants take, and I can give you an example where female migrants, women, they carry with them anti-pregnancy pills in the route to the Middle East route, Yemen route. They carry with them anti-pregnancy pills, knowing that they will be raped, with the potential for rape. They know these risks. They are taking risks with knowledge. It's not lack of awareness. It's a behavioral change and transformation we need, which
Sorry, we lost him.
in terms of the risks that are associated, and we need to move towards that. Thank you.
Thank you very much indeed, Dr. Mahari. Thank you very much. That's very well done. We've got three very related questions at once. The first one, I'll take this all together to Sabelo because he has to address them together. Is there any country with a welfare policy which takes into account the needs and issues of migrants? That comes from Chalo Demise. And the second question, very much related to it, is from Dr. Dorothy Goredma of the Midlands State University, Zimbabwe. My question is directed at Joel. What measures have ICRC put in place for the protection of migrants in need of international protection or asylum during this COVID crisis? And the derivation of that question is from Daniel. COVID-19 has exacerbated the human cost of migration. How is the AU responding to returnees from Saudi Arabia, Lebanon, and so on to keep their well-being? Thank you, three of you, for that very good question. First, we'll move to straight our brother and of course, Excellency Sabelo Mbokazi. Sabelo.
Thank you very much, Dr. Jonas, for those questions, and to the colleagues who are posing the question. Indeed, as colleagues have pointed out, one of the foundational principles of the policies of African Union is driving or an engaging member state to be able to address the root causes of migration. So in other words, as it has been pointed out, that migration is also a developmental issue. In other words, people should be able to make a choice whether I want to travel, I want to migrate, but it should not be a forced migration. But what we see, and there are so many questions, how did we end up to this catastrophe that we see in Libya, Saudi Arabia? It's because people are looking for livelihoods, which in their countries maybe are not adequate or do not exist at all. So that's why in the context now of human rights, in the context of providing policy options, the AU is pushing for extension of social protection to migrant workers, particularly at the country of or destination of these migrants, to say we need to look at the social protection of migrants, social protection of migrant workers, because it has been realized and the data and statistics show that we still have a lot of particularly young people who migrate to Gulf states, to the Middle East, to the European countries. So the question on the welfare, or if there's any country in Africa that provides welfare, so I'm saying these are the policy options that we are providing, the extension of social protection, but also as a AU, we have also launched a migration and health thematic area that is defining and that is going to define the policy propositions on to do with migration and health, so that the migrants are able to have an access to health at every given point in time, because of the golden rule that you provide health services before you even ask whether you have migration papers, whether you are regular or irregular migrant. So this is the work that we are doing in order to be able to address the challenges that are faced by migrants, particularly at the transit as well as the countries of destination. Thank you, Chair.
It's so very much indeed for that very nuanced and extremely rich answer. Thank you. I hope that really hits the nail on the head for those people who questioned, and I really have enjoyed it. There comes another question, comes from Hassani Ahmada Solehi. I come from an island in the Indian Ocean, the Comoros Islands. I'm also a former IPS student. I'm so happy to hear that. Thank you so very much. Welcome back home. I lived for several years in Seychelles, and I currently live in Mauritius. Our region is facing this phenomena, but Comoros especially due to several migrants coming from East Africa who want to go to Mayotte, a Comorian island under French occupation. My question to the ICRC is that, do you have a database on this point? Have you already worked with the Comorian government on these issues? I also work in maritime security and the situation in Obok in Djibouti in the face of immigration to Yemen. What are the recommended solutions? Excellent. So this is a pointed question, particularly to Joel and, of course, her expertise in that area. Joel, the time is yours.
Thank you, Dr. Jonas. I'll actually start with the earlier question on, I think it was asked by Daniel, if I'm not wrong.
Yeah.
Yes, thank you. So, so in response to that, on the response towards asylum seekers and other people in need of international protection during COVID, I'll stress specifically, I wouldn't talk of measures per se, because it's not I would speak more of dialogue and trying to influence certain policies. So of course the ICRC has engaged in bilateral and it's not in the public domain, in bilateral dialogue with at multiple layers with national societies or through national societies, but also with the state authorities on maintaining, especially at the time of COVID, as I said earlier, that the restriction of movements and border control measures have increased and have tightened. So the primary concern for us was the dialogue on the respect to the principle of non-refoulement and maintaining procedures for those who need to seek asylum or to those who need of international protection to continue to have access to these avenues, specifically when they are crossing borders. We've engaged in dialogue on the question of deportations and forced returns. We've called upon states to not to resort to forced returns and to stick to returns that are of voluntary nature. But even then, even when it comes to returns, even those that are voluntary, we've also called on coordination between states in the context of COVID, specifically as some countries may be less prepared than others. I would also point here on the call for release of detained migrants from immigration detention that the ICRC has also done with several authorities, including also the public note on the inclusion of migrants in COVID-19 response, and obviously including refugees and asylum seekers. I hope that answers that question. As for the second question, I'm not sure actually I have the right answer for it, given that it's very specific. But no, we have not. We do not have a database in that sense. I mean, I'm not sure what is meant by a database on this point. I mean, there's obviously multiple databases, but I'm not sure I quite understand here what kind of database is being referred to. But if you mean for this specific context, then the answer is no. But of course, we do follow very closely through our delegations and offices in Somalia, Ethiopia, Kenya, and Djibouti, and Yemen on the situation of migrants moving from the Horn of Africa towards Yemen and the GCC countries. Thank you.
Thank you very much indeed. Thank you. If there's any quick comment maybe from Dr. Mahari, I'll just give him 30 seconds. If not, I'll move on to another comment came from Chrissy or Chrissy. So I'll just go to that. But before that, I go. Is Mahari online? No. Any additional point for you to add? No. Right.
I believe he's online. He's just showed up and then cut again.
Yes. Okay. Dorothy is saying thank you to Jonas and Joel for that adequate response. The question has been well answered. Thank you so very much indeed. That's excellent. That's really helpful. There's a comment from not Bezawerk, from Chrissy, who says, kill the cancer of corruption in different African governance structure. Invest heavily on youth innovation and ideas to retain them in Africa. Therefore, and just maybe, the seamless, endless human rights abuse and disrespect of African migrants will be curtailed if only the African leadership themselves are seen to respect their own citizens. I think that's extremely interesting, thought-provoking recommendation or comment. Thank you very much for that, to be honest. And Bezawerk says, in some cases, unemployment may lead to migration. Refugees are employed persons who need employment. How refugees will participate in an economic activity or activities of one's country? What does the states do, including policy issues? Right, so this is just a final question, I would say, because I'm left with only 5 minutes. I must stop at 12 noon. So any one of you to comment on that final question from Bezawerk, which relates to economic activities and employment and migration nexus? Sabelo can take up, or Joel can take up, any one of you. or Mahari if he's around still. Anyone coming out? Yes.
Thank
Sure.
you. Thank you very much for the question. It's a pertinent question. It speaks to the drivers of migration, particularly the irregular migration, but it also was emphasized earlier on that migration also is a developmental issue, and therefore the issues of labor and employment. These are the issues that we are grappling with in terms of the development of the policies. For instance, we have a policy area here that focuses on productivity.
Quand on parle des options politiques et de productivité au sein d'un État membre, après, nous cherchons également donc, à mettre en œuvre des politiques concernant le travail informel et sa reconnaissance. Mettre l'accent sur le secteur informel, lequel secteur qui, en réalité, qui est très important. C'est là où un grand nombre de personnes restent actifs, productifs et maintient ces personnes employées de façon stable. Et c'est aux États membres de reconnaître qu'il faut de façon plus importante de ce secteur informel. Et puis pouvoir appuyer ces travailleurs informels. Ceci aurait comme conséquence d'atténuer les migrations clandestines. Pour parler d'avenir, quel sera donc l'avenir? Et c'est là où l'Union africaine essaie d'intervenir, c'est-à-dire proposer davantage d'appui en matière d'emploi et dans le secteur informel, bien sûr. Nous avons déjà pu témoigner de la preuve des contributions en matière de dans le milieu de l'emploi par ce secteur informel. Merci beaucoup. Voici donc une question. Bon, j'ai une question donc en tant qu'éditeur principal, éditeur en chef d'un journal en Angleterre. Comment donc limiter les migrations irrégulières? Est-ce que vous pourriez en dire plus? C'est une très bonne question. C'est une très bonne question. Aujourd'hui, nous considérons plusieurs partenariats pour voir comment on peut propager les renseignements, notamment des informations qui sont basées sur l'évidence et les preuves portant sur la migration irrégulière notamment. C'est un domaine qui exige énormément d'efforts et nous en sommes bien conscients. Merci beaucoup. Merci. Il est désormais temps de chercher à synthétiser le contenu de notre dialogue de façon très prudente. Merci infiniment à chacun. Nos délibérations continuent et à l'instant, j'aimerais commencer par remercier le CICR pour un partenariat excellent et merci aussi à tous ceux qui donc se sont joints à ce webinaire pour y participer activement. Merci à l'Institut IPSS, merci à Rubia Leti qui a donc rendu ce webinaire possible. Je chercherai aussi à remercier toutes et chacune qui ont participé donc à l'organisation de ce webinaire. Sachez que l'Éthiopie fête son nouvel an 2013 et de ce fait, chacun est désormais plus jeune de 7 ans. Donc, continuons ce même dynamisme et à bientôt. Merci. Merci infiniment.
Thank you, everyone.
Merci Mahari, merci Joël. Merci beaucoup.